Good morning, my fellow Americans. Welcome to the Grassroots Army podcast. I'm, of course, your host, former Michigan gubernatorial candidate Garrett Soldano, and I am just not only honored but excited as heck to have Dr. Bowden on, who has just been on fire over on X with what she's doing. And so we're gonna be talking a lot of different things today about what she's pushing. She is leading the charge with trying to get this shot off the market, and she's gaining steam, everything that we're saying. I mean, as of yesterday, I think you posted that you have 122 elected officials, 120 candidates, and one surgeon general from 39 states publicly stating that the shots must be pulled off the market. Is that correct, Dr. Bowden?
Yes. And it happened in a matter of months, and it just keeps growing. I have at least 3 more people to add to the list today, and hopefully after this broadcast, a few more.
Yeah, and that's the whole intent with why we're doing this. You know, I've been standing up for medical freedom for many, many years, and we just appreciate the heck out of you. And just before we begin, folks, this is a call to action to everybody that's writing right now. In the description of this video that you can see, you're going to see a website that you can send and you can email to your candidates, to your elected officials, and it's Americans for healthfreedom.org /sign the pledge. The link's in the description. Send that to your elected officials. Send that to the folks who are running. Follow Dr. Mary Bowden on X. I mean, she is nonstop going after everything, holding people accountable, even Houston Methodists. I mean, it's all over. So we appreciate what you're doing. But I want to go back to way in the beginning. That's kind of like what I do with all my healthcare professionals, to kind of see the evolution of where your headspace was, especially all the way back in the beginning of the pandemic in early 2020. When did you just start to know and realize like something was up?
Well, yeah, I'm a solo EMT. I had a very quiet practice. I started having the COVID patients come in a little bit here and there. I used common sense, breathing treatments, steroids, antibiotics. And then I started using monoclonal antibodies, and those worked really well. And then the government started taking over distribution. And that was my first hint, like, why can't we no longer get these monoclonal antibodies? And then once the monoclonal antibodies completely disappeared, I started looking to alternatives, ivermectin, hydroxychloroquine. And then that was my second clue that something was going on, when I kept getting roadblocks to getting these medications to people. So pharmacies refusing to dispense the prescriptions I wrote. And then I live in Houston. Houston Methodist is the first hospital in the country to mandate the COVID shots. And I started having all these patients coming to me very distraught over these mandates. And then I started seeing all the breakthrough cases where patients were just as sick, if not sicker, who were fully vaccinated. And I actually went to Methodist. I said, "What's going on? Are you seeing what I'm seeing? Like, I thought the shots were supposed to protect people." And then they just basically stonewalled me. And so I started speaking out on Twitter. And at the time, I was pretty cautious. I said things like, ivermectin works and vaccine mandates are wrong. But there was one day where I tweeted out 25 times the exact same message. And I said, vaccine mandates are wrong. And then I posted a patient testimonial under that statement. 5 days later, Methodist went after me in a very public fashion. I looked down at my cell phone and I saw a text message from a reporter at the Houston Chronicle asking me to confirm, is it true that my privileges had been suspended? And I was blindsided. I did a double take. I'm like, what are you talking about? And then I go to my email and I see the letter from Houston Methodist saying they suspended my privileges. And then I go on Twitter and they're tweeting about it. So that just sort of changed things from that point on dramatically.
And that's what they do, right? If you stand up against Big Pharma and their agenda, they're going to try to squash you. Just like we talked about before we went live today. You know, the same thing happened with me is when I was standing up against the lockdowns, they were going after my license, saying I was advocating the spread of disease and I was endangering the public with standing up against the quarantine. And, it's just everything that we've been standing up for over the past 4 years has been proven, in fact, to be right, that there are other ways to treat this. They were under treating it in the beginning, and the mandates and everything else that they were doing is not only unconstitutional, but obviously did have no good positive result of stopping and slowing the spread of this thing, because it's basically a cold. Good luck trying to stop the cold. So I want to move into, after that, obviously, because let me go back to, 2021, I think is when the emergency warp speed happened, right? That there was no long-term safety and efficacy studies on this thing. And they were just going to basically get everybody to get this procedure done on them. And so I want to go back to 1976. And a lot of people aren't familiar with this, but the swine flu epidemic. And I want to talk about some of the things that happened with it, because at the time, it's kind of same scenario. The U.S. president at the time, President Carter, I think it was, did a warp speed effort. And this is from an article from back then, to vaccinate every man, woman, and child in the country. And that year, the fear that was pushed down everyone's throat was the swine flu was starting to loom large. And they started to push this thing through to the American population based on, and this is from the article, ill-founded science and political imprudence. And 3 people died. And guess what they did when 3 people died? They did what?
They pulled it off the market, of course.
Pulled it off the market. Because at the time, you could actually sue pharmaceutical companies for side effects and deaths. Not until 1986, when the Child Vaccine Injury Act went into effect, that you could not sue Big Pharma anymore. But 3 people died, and they pulled it off the shelves. What amount of people need to be injured for them to even consider pulling this thing? I mean, what is it now? According to theirs? I don't even know. It's astronomical.
On VAERS, there are, I think, 33,000 reported, and now they've stopped accepting reports, so it's maybe higher than that. I looked at the patient population from the last 2 years. 7% of my new patient appointments were for people with chronic debilitating health conditions following these shots. These were people who were healthy before. They had, it was very time related, their injury, and all the same pattern of symptoms. Never seen anything like it. And yet we speak out about it, and we either get stonewalled or canceled. It's unbelievable.
Yeah, Nate, and they're still trying to do it to these days. And I tweeted the other day, COVID is over. That's what the establishment wants to move on and pretend it didn't happen, right? Mm-hmm. It's the one issue that you said that affected every voter, and it's important to keep the dialogue alive. And I agree with that, because a lot of people that kind of bought into this thing, they just want to forget about it. Like, they won't admit it. They don't want to talk about it. And I think it's very important to continue to bring it up so we don't make the same mistake twice. That's a definition of insanity, doing the same thing over and over again and expecting a different result. And this leaked all the way down to the local school boards with their unnecessary mandates of what they were doing to these kids and the mental health crisis that they put in these kids. And I agree with you, Dr. Bode. We just can't quit talking about this. We need to look at all the data like good doctors, and we have to make sure that we never make the same mistake again. And it seems like even both parties, I mean, the only candidate that I really see continually talking about it, a major candidate in the presidential race, is RFK, right?
Right. And, you forget these shots are on the pediatric vaccine schedule. So all children ages 6 months and up are expected to get these shots. It's just horrifying. I mean, we know the government even admits there's a risk of myocarditis with these shots, and to be giving them to small children cannot, nonverbal children will not tell you that they have chest pain, right? So they could be getting silent myocarditis, causing a permanent scar on the heart, and may not manifest for years down the road. They're running down the soccer field and drop dead. I mean, that's what we're potentially looking at. It's very frightening.